Was it stones, groans, bones, psychiatric overtones, right? That's what happens when there's high calcium. So high calcium, maybe that's why they have constipation, right? And this beautiful photo of bilateral hilar lymphadenopathy. So this question is like giving you everything. They tell you whatever the case has in sarcoidosis. Okay, we have microscopic Schaumann bodies, rheumatoid arthritis, rheumatoid-like arthritis, high calcium, ocular uveitis, interstitial fibrosis, vitamin D activation, skin changes. Do you see constipation here? No, but I see high calcium. And high calcium tells me certain things you need to know: stones, bones, groans, psychiatric overtones, right? Okay, so watch this now. I don't want to know the answer. I want us to eliminate the answers. The more you can take time to eliminate answer choices, the stronger you're going to become. All the students that I know that are trigger happy, they just click and go, click and go. There's so much information you're leaving behind. And you might get questions right, but then you're not realizing you never get the same question again ever, right? So TB, no. Low serum angiotensin converting enzyme? Oh, because didn't we have the mnemonic that said it was high? Yeah, it was right here. High. Elevated. We have non-casing granulomas, elevated ACE levels, elevated this ratio, and then we have all this beautiful sarcoids mnemonic, right? Okay, so it's not low, it's high. Okay, now would the answer be C? Elevated serum parathyroid hormone? I mean, I don't think so. Why would it be high? It would be low because a person has high calcium. Well, it doesn't say high calcium here. They don't give you a lab value, but you know it's sarcoidosis because of other findings. That should then lead you to, I know that non-casing granulomas, we have high ACE levels, high CD4, CD8 ratio. So we also have high calcium, right? That's going to trigger a negative inhibitory metabolic pathway. It's going to negatively inhibit PTH. So PTH is going to be low, not high. It just can't be. It has to be low because you're negatively, it's a negative feedback mechanism, right? Simple. So knowing that it's high calcium, how do you know, Stavros? Well, you don't see any lab, they could give you lab value. Some do. This one doesn't. They presenting to you sarcoidosis. So you need to know it's high calcium. And the constipation could possibly help you too. So learn the mnemonic and learn the presentation. It's not that bad. So we're down to 2, guys. We have elevated CD4 T cell count in bronchoalveolar lavage and positive anti-double-stranded DNA antibody. You're like, oh, I don't know which one's which. But if you remember this little mnemonic or this little first aid, immune-mediated, widespread, all over the body, non-casing granulomas, elevated ACE levels, elevated CD4, CD8 in bronchoalveolar lavage. Also, we know that this here, anti-double-stranded DNA, what does that trigger? What answer is E? What's E? Where is this positive anti-double-stranded DNA antibody testing consistent with? SLE. So this is live example that A, you read the scenario, you extract what you can, you say, well, I think it's sarcoidosis. Okay, fine. They don't ask you about sarcoidosis. They say what other additional findings you'll find in the patient. So you need to know more about sarcoidosis. So either A, you can say, well, oh, there's the answer. Boom, let's go. Or you can't do that, but you can say, well, okay, I mean, I'm not exactly sure what the answer is, but I can tell you it's not TB, it's not low serum angiotensin, it's high actually, because remember it's high ACE levels. It's not elevated serum parathyroid hormone because the person has high calcium, and because of that, it's going to be negatively inhibiting PTH. PTH only is increased if we need high calcium. If we need calcium, we don't need calcium. There's a lot of calcium in this patient. And double-stranded, that's SLE, man.